So the reason we did this is living kidney donors undergo the exhaustive evaluation to ensure they have normal kidney function and exclude them for risk factor for chronic kidney disease. But despite a careful selection, there's a small subset of low renal function post donation. And as you know, we use serum creatinine and proteinuria as some markers. And if they have that abnormal markers are excluded. So there's not really good biomarker or anything that we can say and potentially aim those patients. So here in Mayo Clinic, we have the advantage as a standard of care. We have detailed pre-donation CT images that we look at the angiogram and cortical phase, and then they're basically obtained and downloaded the workstation, and we get very good detail of the cortical volumes of the patients. Also, as a per routine of clinical care, intraoperative needle core biopsy of the renal cortex are performed at the time of transplant so that we have the tissue of the donor at the time of time zero implantation biopsy. So we can determine what is the normal pathology or histology of the patient. Hi, my name is Mr. Merskani. I'm a transplant nephrologist. We're going to be discussing our article, Kidney Microstructural Features at the Time of Donation Predicts Long-Term Risk of Chronic Kidney Disease in Living Kidney Donors. So in this study, this is a prospective cohort study of living kidney donors, adults about 18 years old or equal, at Mayo Clinic here, Rochester, Minnesota, and Arizona, from the period May 1st, 1999 through December 31st, 2018. It's a part of the aging kidney anatomy study. Our inclusion criteria are patients who had a time zero biopsy and who had a suitable biopsy to be measured, at least greater than 2 millimeters in non-distorted cortex and at least 4 glomeruli per biopsy. To study long-term kidney function, so we connect those donors who donated at least greater than 5 years and who had a follow-up participation. So through the Mayo Clinic survey researcher, we contacted the donors via mail using a survey, and we were following by calls, and they were allowed to and make sure that the donors were allowed to complete the survey by mail or by phone interview. So we asked about the donors, what is the last blood pressure readings, height, weight, and serum creatinine, and also those who were lacking of blood pressure, height, and weight, and serum creatinine were remunerated to go to a local provider. Also, the donors were asked if they have been told by the physician provider that they take care of them, if they have told if they have proteinuria. So our outcomes, we assess if the donors have a lower EGFR less than 60, a EGFR less than 45, a lower residual EGFR, incidence of hypertension. So we obtained 807 donors who were surveyed, at least 10.5 years of follow-up. None of the donors reported having renal replacement therapy during the follow-up period. And the incidence of hypertension at new onset was 18.8, developed hypertension. Clinical predictors as for development were male sex, higher BMI, and higher baseline blood pressures, but none of the histological features predicted having higher incidence of hypertension. Our outcome is having a lower EGFR less than 65. After adjusted for predictor, having larger glomerular volume and the same as larger nephron size, and low nephron number for age predicted having a lower EGFR than 45. Also, we look at the predictors as an EGFR less than 60, time to donation, but none of the predictors, microstructural predictors, predictive having a lower EGFR less than 60. To look at the residual EGFR, this is the ratio between the follow-up EGFR and the pre-donation EGFR, the mean residual was 74.8%. Low nephron number for age predicting having a lower residual function. Also, we look at the self-reported proteinuria. Self-reported proteinuria were 5.1%. And the only one that predicted having a self-reported proteinuria having a larger glomerular volume, it is the same as a larger nephron size. The main discovery is that a decade after donating a kidney, living kidney donors with low nephron numbers for the age at risk, the development lower kidney function, and their pre-donation level, and also having large glomerular volume and low nephron number have an eGFR less than 45. Donors who had enlarged glomeruli also at risk to have a lower kidney function and also abnormal protein spilling in the urine, which are markers for chronic kidney disease. And we can look at the new histological factors from the donors at the time, and also what is the baseline, what the recipient is going to receive. So this is different. This is we with in the aging kidney anatomy has done a lot of work in looking at what is the histological features of kidney donors in normal kidney biopsy and aging of the kidney. Patients who will have low, surrogate markers of low nephron numbers, larger glomerular volume, like for example, low term birth weight and preterm deliveries. Patients that we should target to have a close monitoring renal function after donation, and having a visit for a nephrologist or close follow-up checking serum creatinine. So next steps, we have to further studies like subclinical microstructural features. We determine, but it is not feasible to do biopsy at all the patient. We will have to determine less invasive biomarkers are needed to have a surrogate markers for low nephron numbers and larger glomeruli. More feasible studies in clinical settings will have to be done. So in summary, lower nephron numbers and larger glomeruli volume were long-term predictors for risk for kidney disease after donation, independent of the other clinical predictors.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.